sore saudara-saudara sekalian di Indonesia. Selamat datang kembali di acara Facebook Live. Saya dari bilang kita kembali karena kita sudah 2 kali melakukan ini kali yang ketiga. Pada malam hari ini kita akan sharing pada Anda tentang bagaimana kanker payudara dan kanker paru-paru diobati pada tahun 2020. Saya Joni Sulistyo, di sebelah saya Dr. Hwai Loong yang akan share. Saya akan membantu untuk menerjemahkannya. Acara ini bisa terjadi karena kerjasama antara Smarter Health dan Icon. Smarter Health adalah perusahaan di bidang digital health, sedangkan Icon sebuah konsorsium atau sebuah persatuan dokter-dokter yang berkeahlian dalam bidang kanker. Dokter Kong salah satunya. Supaya lebih singkat, saya ingin memperkenalkan Dr. Kong untuk memperkenalkan dirinya sendiri. Can you introduce yourself now?
Thank you, Dr. Johnny. Good evening. My name is Dr. Hwai Loong. I'm a medical oncologist from Singapore, and it is my privilege this evening to be able to share some of the important information with you regarding breast cancer first, and then lung cancer to follow. Good evening.
So, Dr. Kong, saya mesti sebutin orang Singapura, dokter Singapura pertama yang mendapatkan award dari American Cancer Society. So, kita beruntung dia masih muda dan kita semua bisa mendapatkan sharing darinya. Dr. Kong, the audience is yours. Can we start?
Sure, thank you. Alright, so I'm going to divide my presentation tonight into 2 sessions. The first session is on breast cancer, and the second session will be on lung cancer. So without further ado, I'll go ahead and give my presentation on the breast cancer, and following that, feel free to ask questions and we'll be happy to entertain them. So the breast cancer is the #1 cancer in women, and in fact, in America, 1 in 8 women would develop breast cancer in their lifetime. In Singapore, in other parts of Asia, maybe it's about 1 in 10, 1 in 12. It's still a very common disease. The second important fact about breast cancer is that it spreads early. Even a small cancer can spread. But the third point, which is most important, is if we pick it up early, breast cancer can be cured.
Jadi kita mulai dengan tumor pada payudara. Ada fakta yang terjadi yang Dr. Kong sharing. 1 di antara 8 wanita di USA atau di Amerika mengalami kanker payudara. Tapi kalau kita lihat di Asia, 1 dari 3 penyakit kanker di Singapura, mungkin juga di Indonesia atau di Asia yang lain, adalah kanker payudara. Dan dia menyebar dengan sangat cepat. Namun jika bisa dideteksi lebih dini, maka pengobatannya bisa lebih mudah.
Now, if you look at this slide on the screen, you will see that in women in Singapore, breast cancer is #1. And if you look at the right-hand side of the curve, you will see that breast cancer not only is common, it is rising in incidence over the last few decades.
Kalau Anda lihat data statistik ini, kanker payudara tetap menjadi nomor 1. Coba lihat sekarang grafik di sebelah kanannya. Bukan cuma nomor 1, tetapi juga meningkat jumlahnya.
So, one important question that patients and the families like to ask the oncologist is, what caused the cancer? What are the factors that increase a person's chances of getting cancer of the breast? There are a few. First of all, age. It's obvious that the older you are, the more likely you are to develop breast cancer, because with aging, the immune system weakens. Secondly, if you have a family member with breast cancer, the likelihood of you developing breast cancer yourself goes up. In fact, in some families where there are a number of people developing breast cancer or ovary cancer within the same family, they may have a gene called BRCA1 or BRCA2 that raises a breast cancer risk to even much higher level. Thirdly, if a woman were to develop the first menses when they are younger than average, let's say 9 or 10-year-old, and then they go on having menses till they are in the mid or late 50s, the many years of having regular menses increase the exposure of the breast to estrogen. That also increases breast cancer risk. Similarly, if a woman has never been pregnant or the pregnancy comes late in their 30s, again, many years of having menses will increase the chance of breast cancer. In addition to these physiological factors, there are other lifestyle factors which increase the chance of breast cancer. For example, if you smoke more or drink a lot of alcohol, the risk goes up. If you have a problem of obesity, breast cancer risk goes up. Or if you have a sedentary lifestyle without much physical activity, breast cancer risk also goes up.
Ada beberapa penyebab kanker payudara. Yang pertama adalah karena usia. Bertambah panjang usia seseorang, maka tingkat kekebalan dia akan menurun. Yang kedua adalah karena faktor genetik. Di antara keluarga-keluarga yang mengalami kanker, biasanya dia membawa genetika, faktor genetika yang kita sebut sebagai BRCA1 atau BRCA2. Yang lain adalah masa menstruasi yang terlalu panjang karena dia mulai menstruasinya terlalu muda, lalu kemudian dia berhenti menstruasi yaitu menopause terlalu lama, dia akan terekspos terhadap estrogen terlalu panjang. Yang berikutnya adalah kalau dia tidak hamil-hamil atau hamilnya sudah terlalu tua, itu juga akan lama dia terpapar terhadap estrogen. Faktor-faktor yang lain di luar faktor fisiologis adalah faktor-faktor gaya hidup. Orang-orang yang minum alkohol lebih banyak, orang yang merokok lebih banyak akan berisiko lebih banyak. Faktor kegemukan, lalu malas gerak atau mager, itu juga akan memberikan risiko lebih banyak.
Now I would like to share some important medical facts about breast cancer which is good for the viewers, and the doctors would typically explain these facts to the patient and the families. First of all, breast cancer likes to spread, and it does so early on in the disease. So even a very small tumor, 1 cm tumor, has a chance to spread. And typically a breast cancer likes to spread from the breast to the lymph nodes in the armpit, and sometimes it will go even further to other organs such as the lungs, the liver, the bone, and the brain. The second fact is that about 2/3 of breast cancer have this thing called hormone receptors in the cells. If the breast cancer cells have the hormone receptors, which can either be estrogen receptor ER or progesterone receptor PR, if the receptors are present, the tumor cells will get the energy for growth from the female hormones that the woman has. And this important fact allows the doctors to use pills to shut down the hormone system to control the cancer. And the third point, about 1/5 of breast cancer would have a special receptor called HER2, HER2, on the surface of the cancer cells. When these receptors are present, the cells are aggressive. They are like a switch on the wall, always turned on, and the cells keep growing. But fortunately, we now have many good drugs that can control breast cancer that are HER2 positive.
Mari kita tengok fakta medis penting dalam kanker payudara. Yang pertama adalah kanker payudara itu menyebar amat sangat cepat, bahkan dari sejak awal. Ukuran 1 cm itu sudah bisa menyebar ke tempat yang lain. Anda bisa raba misalnya di ketiak, di kelenjar ketiak, kelenjar getah bening ketiak, atau bahkan lebih jauh, bisa ke hati, ke tulang, atau ke otak. Fakta lain, 2/3 dari penderita kanker payudara, sel kankernya bisa ada yang namanya hormon reseptor, yang disebut ER atau PR. Nah, hormon-hormon reseptor-reseptor ini akan sangat amat rentan terhadap paparan estrogen. Itulah sebabnya kenapa nanti kita bisa tahu ada yang bisa diobatin dengan terapi hormon. Tapi 1/5 dari penderita kanker payudara ada yang namanya reseptor HER2. Nah, kalau si sel kanker itu HER2-nya positif, maka dia akan amat sangat-sangat agresif.
So I'm going to go on to discuss how do we detect breast cancer in the early stage. This is the concept of breast cancer screening. Screening means you are trying to pick up early breast cancer in women who feel entirely well. They are not suspecting themselves to be having cancer. These are the people probably listening to this presentation now. So the best way to do the breast cancer screening is mammography or mammogram, which we advise women to start doing from the age of 50 years and older. In fact, for people with a strong family history of breast cancer, you might even consider starting the screening from age 40 onwards. In addition to mammogram, sometimes the doctors will add in an ultrasound of the breast to increase the sensitivity and the specificity. If the mammogram or ultrasound shows something which is not quite right, then the biopsy will be recommended on that particular area to see whether there is a cancer in there or there isn't.
Ada cara untuk melakukan screening kanker payudara, dan screening ini biasanya dilakukan pada wanita-wanita yang usianya sudah di atas 40 atau 50 tahun. Tujuan dari screening ini tentu saja untuk mendeteksi secara lebih dini. Nah, yang paling mudah dan tidak terlalu invasif adalah mamografi menggunakan X-ray. Sebaiknya wanita-wanita di atas 50 tahun itu melakukan pemeriksaan screening mamografi untuk mendeteksi secara lebih dini. Tapi seringkali juga mamografi tidak cukup, sehingga dokter menganjurkan supaya bisa lebih akurat dengan menggunakan ultrasound. Kadang-kadang setelah ultrasound, dokter perlu juga melakukan pemeriksaan biopsi untuk mengetahui betulkah itu sel kanker atau bukan.
Let's say we now have a woman who is suspected to have a cancer. So what happens next? The biopsy will be done, then that will be sent to the pathology department to confirm cancer and to do tests like ER, PR, and HER2 I mentioned earlier. Now, once the cancer is confirmed, the next important thing is to determine the stage of the cancer. To do that, we need to send the patient for some radiological tests. For example, a chest X-ray, ultrasound to liver. You can do a bit more by doing a CT scan. Or in the patient with a bit more advanced cancer, we might even do a specialized scan called a PET CT scan that shows up a lot. With any of these scans, the doctor will then determine whether the patient has a stage 1, 2, 3, or stage 4 breast cancer. Fortunately, most breast cancers are detected in stages 1 and 2, allowing us to provide cure to the patient eventually.
Mendiagnosa kanker payudara tadi sudah disebutkan dari hasil biopsi kan. Nah, dari hasil biopsi dokter pengen tahu apakah dia ada reseptor ER, apakah dia ada reseptor PR, atau si sel kanker itu ada reseptor HR1 gitu ya, atau HR2. Nah, dari situ kita sudah tahu oh ini kanker. Tapi kita pengen tahu apakah sebaran kanker itu sudah lebih jauh daripada sel kanker yang ada di situ dengan melakukan pemeriksaan chest X-ray atau pemeriksaan ronsen paru-paru, pemeriksaan ultrasound untuk melihat apakah ada sebaran di liver, pemeriksaan bone scan untuk melihat apakah ada sebaran di tulang, atau CT scan atau PET scan di tempat-tempat yang lain. Nah, kalau diagnosa sampai dengan sini bisa ketahuan, kita bisa tahu ini stage-nya 1, 2, 3, atau 4. Nah, kita beruntung kalau kita bisa menemukan stage 1 atau stage 2, maka potensi kesembuhan dia akan jauh lebih besar.
So I'm going to turn the attention now to the management of women with early stage breast cancer. That means stage 1 or stage 2, which is the commoner presentation today. So for these women with early stage breast cancer, we are aiming for cure. And to do that, we will send the patient for surgery, after which there will be chemotherapy, sometimes radiotherapy, sometimes even hormonal therapy if the tumor cells are positive for ER and PR. And we do these different things in sequence, eventually hoping to provide cure to these patients.
Sebagaimana kita mengobatinya kalau ketemu itu? Ada, kan tadi ada stage 1, 2, 3. Kita ngarep kalau stage 1, 2 itu lebih cepat, lebih mudah mengobatinya ya. Pertama dengan pembedahan. Setelah dilakukan pembedahan, maka ada terapi radiasi atau radioterapi, lalu kemudian kemoterapi. Jika ditemukan ada reseptor-reseptor seperti yang tadi disebutkan, ER, PR, HER2 gitu, kita bisa mulai melakukan dengan pengobatan hormon terapi atau targeted terapi.
I'm going to present some information regarding surgery, because surgery is the starting point of management of most early stage breast cancer patients. So surgery in the old days involved what we call mastectomy. Mastectomy means removing the entire breast, even if the tumor is only occupying a small part of the breast. But in the last 10, 15 years or so, the doctors prefer to do smaller operation. It is called breast conserving surgery, or BCS. Breast conserving surgery remove only a portion of the breast, not the whole breast, a portion of the breast. In that way, the surgical time is shorter, recovery time is faster, and the shape of the breast look more like natural and without the need for reconstruction. At the same time, we also avoid doing excessive surgery to the armpits. In the old days, you clear the whole armpit, the patient will have arm swelling. Nowadays, we seldom do that. We just take 1 or 2 lymph nodes from the armpits, what we call sampling. If the sampling is clear of cancer, no further surgery to the armpit is required. So surgery has become more and more minimalistic, allowing the patient to have a quicker recovery.
Pengobatan kanker tadi sudah dimulai dengan pembedahan. Zaman dulu pembedahan dilakukan mengangkat seluruh kelenjar payudara itu. Sekarang atau 10-15 tahun terakhir, dokter lebih suka menggunakan pendekatan yang lebih friendly, lebih ramah kepada pasien, yang namanya adalah BCS, Breast Conserving Surgery, artinya pembedahan yang bisa mempreserve, yang bisa memelihara si kelenjar susu itu menjadi tetap ada. Kalau dulu diambil semua, kalau sekarang masih tetap ada. Jadi payudara yang akan diambil hanya sebagian saja yang ada tumornya. Nah, dengan cara seperti begini, pembedahannya menjadi lebih minimal. Tingkat kendalinya sama, penyembuhannya sama, tetapi operasinya menjadi lebih kecil, lalu secara kosmetis lebih bagus, dan tidak memerlukan operasi pembedahan yang lain. Setelah itu biasanya dokter mencoba mengambil kelenjar getah bening di ketiak. Nah, sekarang dengan cara seperti ini, kita hanya cukup mengambil sampelnya saja. Kalau ternyata sampel itu tidak ada, ya sudah dibiarkan saja. Jadi tidak ada kerusakan lengan atau menjadi bengkak karena kelenjar getah beningnya tersumbat.
I shall now present 2 common pathway or scenario where early breast cancer patients are managed. In the first scenario, the patient's tumor is quite small. She will undergo surgery first, and then, if necessary, chemo will follow, and then, if necessary, radiotherapy will follow, and finally, if the tumor cells are ER, PR positive, they will then take tablets for 5 to 10 years.
Ada 2 cara pengobatan. Kita mencoba mereka-reka. Kalau kankernya kecil, maka kita awali dengan pembedahan, lalu diikuti dengan kemoterapi, lalu kemudian radioterapi, dan kalau ada indikasi yang tadi reseptor-reseptor ER, PR, dan HER2 positif, maka kita bisa melakukan pengobatan hormon selama 5-10 tahun.
The second scenario is if the patient's tumor at presentation is too large. So large that the surgeon cannot remove only a part of the breast. The whole breast has to be removed, and that's not good. So in that scenario, we will do a bit of a rearrangement. We'll do the chemo first to shrink the tumor, and then the surgery takes place. And after surgery, the rest of the treatment will just follow.
Skenario kedua adalah apabila si tumornya terlalu besar. Kita memodifikasi sedikit dengan memberikan kemoterapi, tujuannya supaya si hormon itu menjadi sedikit menciut. Setelah dia menciut, baru dilakukan pembedahan, lalu kemudian radioterapi dan tindakan lanjutnya.
Okay, so the next part of this presentation will now focus on the patients who unfortunately present with advanced cancer. So we're talking about women with stage 4 breast cancer, where the cancer cell typically spread to the lungs, to the liver, to the bones, or to the brain.
Kita sekarang lanjut sedikit bagaimana mengobati pasien-pasien dengan kanker payudara yang sudah lanjut. Pengertian sudah lanjut artinya sudah ada penyebaran misalnya ke paru-paru, ke hati, ke otak, ke tulang.
In the treatment of patient with a stage 4 breast cancer, there are a few important points to take note. First of all, they are usually not curable. Curable means that you can stop treatment and the patient remains cancer-free. So for these patients with stage 4 cancer, treatment has to be ongoing all the time. Now the purpose of treatment of such advanced cancer, even though they are not curable, is to make the patient feel better and to make the patient live longer. And there are many ways to do that. Primarily is the use of certain drugs that oncologists will give to try to fight the cancer, shrink the cancer, to prolong the life.
Pengobatan dengan kanker lanjut itu sebenarnya tidak bisa disembuhkan. Pengertian tidak bisa disembuhkan adalah kita tidak bisa menghilangkan kanker itu. Lalu kalau begitu pengobatannya jadinya seperti apa? Untuk stadium 4 ini tujuannya untuk mengurangkan gejala, mencegah komplikasi, dan memperpanjang usia. Nah, dokter onkologi akan memberikan kemoterapi, antibodi, terapi hormonal, target terapi, itu sepanjang sisa hidupnya dia harus melakukan pengobatan tersebut.
So there are many drugs that oncologists can use to treat patients with advanced breast cancer. I will divide them into 4 big groups. The first group is called chemotherapy that many people are familiar with. Chemotherapy is well known to cause some side effects like hair loss, some nausea, some other fatigue and so on, sometimes the blood count drop leading to infection. But generally speaking, chemotherapy nowadays is quite well managed. The side effects are manageable and is generally quite safe. The second group of drugs involve what we call antibodies, particularly antibodies that are attacking the HER2, which I mentioned earlier. So these HER2 antibodies are very effective in shrinking tumors. The third category of drugs are the hormonal therapies, and these hormonal therapies are either pills or injection to try to shut down the hormone system. If the hormone system is shut down, there's low estrogen, the tumors that are ER, PR positive will grow slower. And finally, we now have new drugs that have come out in the market in the last few years, which are either pills or injections that can actually use molecular method to fight the cancer in treating cancer very effectively without the use of chemotherapy.
Pengobatan untuk kanker payudara lanjut itu yang harus makan obat sepanjang sisa hidupnya itu kita bisa bagi 4 kelompok. Satu kelompok kemoterapi. Kelompok kemoterapi kita sudah tahu bahwa akan ada efek samping seperti rambut yang rontok atau mual atau bahkan sisa darah putihnya menurun sehingga dia mengalami infeksi. Tapi sekarang ini obat-obat kemoterapi sudah lebih ramah sehingga bisa diatasi rasa efek sampingnya itu. Kelompok yang kedua adalah kelompok antibodi. Antibodi itu tujuannya untuk menghentikan pertumbuhan pada sel-sel yang tadi ada HER2-nya positif. Nah, kelompok yang ketiga adalah kelompok hormonal. Kelompok hormonal ini si pasien akan makan obat untuk menekan efek hormon estrogen kepada si sel kankernya. Nah, yang terakhir adalah targeted therapy. Targeted therapy ini biasanya menggunakan teknologi atau pengetahuan molekuler. Jadi kita mesti belajar lebih banyak tentang sel-sel secara sel-sel kekebalan.
So in the last slide of this presentation on breast cancer, I want to just address some general points about the treatment of advanced cancer. Some patients, when they see us, they ask the question, if they have a stage 4 cancer and cannot be cured, what is the point of treatment? Well, first of all, the treatment of breast cancer nowadays is quite well managed in terms of side effects. And number two, patients tend to respond reasonably well. Some even live on for years. And thirdly, the quality of life during treatment can be quite good. Many patients continue to work. They certainly continue to travel for holidays, and they can exercise and do the things they used to enjoy before they had the cancer. So if you have a stage 4 breast cancer, speak to your local doctors because it's worthwhile treating. Don't give up. And importantly, breast cancer research is very active, and we are seeing new drugs coming into the market very quickly. So there is a reasonable hope in the future. Better drugs are available to help you. So the point is, stay positive, don't give up, talk to your doctors about the treatment options.
Buat teman-teman yang mengalami kanker payudara lanjutan, ini ada tips dari Dr. Kong. Pasien-pasien dengan kanker stadium 4 ini banyak yang bisa hidup dengan baik karena memang bisa dikelola dengan baik. Hidupnya masih bisa lebih panjang, dia bisa menikmati jalan-jalan, bepergian, bekerja, berolahraga, dan seterusnya. Tapi ada hal yang penting, bahwa penelitian untuk kanker payudara ini terus berlangsung sehingga harapan untuk bisa sembuh itu selalu ada. Jadi berpikirlah positif, berhubunganlah dengan dokter-dokter Anda supaya Anda bisa mendapatkan pelayanan kesehatan dengan lebih baik. Dr. Kong, you said that this is the last slide.
Yes.
Now, can we respond to our audience, right?
Sure, we can.
Okay.
Yeah.
Teman-teman, saya mencoba mempick up beberapa pertanyaan yang teman-teman berikan. Ada satu pertanyaan di sini. Halo dokter, saya mau tanya apakah kepadatan payudara dapat meningkatkan risiko terkena kanker payudara? Dan pada wanita Asia yang memiliki payudara yang lebih padat dari wanita Amerika, wanita di Asia memiliki risiko lebih besar untuk terkena kanker payudara. Pertanyaannya seperti itu. Let me translate.
Sure.
Is there any risk toward breast cancer for those having the breast more tense? It's perceived that Asian female has the consistency of the breast is more dense.
Yes. This is actually a very good question. The question is actually very timely one for this Asian Facebook live streaming, because it is in fact quite true that most Asian women have more dense breast tissues compared to the Caucasian counterparts. And the dense breasts have two problems in terms of breast cancer. The biggest problem is the detection of small breast cancer when the breast is so dense. When the breast is very dense on a mammogram, everything looks white. You're looking for a white spot in a white background. That's often difficult. Sometimes you need to do things like MRI of the breast in order to differentiate between what is normal and what is early breast cancer. So the first problem is a diagnostic problem. The second problem is, would a dense breast actually increase the risk of breast cancer? There is some debate about this, but generally speaking, the dense breast is very common. Many women with dense breasts do not get breast cancer. But I think the bigger problem is a diagnostic problem rather than a dense breast increasing the risk of breast cancer significantly.
Anggapan bahwa payudara yang lebih padat itu lebih berisiko ada betulnya. Tetapi lebih karena problematika diagnosa. Tumor payudara yang masih kecil, ketika dia ada di tengah-tengah jaringan payudara yang padat, di mamografi kelihatannya menjadi samar. Karena tumor harusnya putih, sedangkan sekelilingnya juga warnanya putih karena dia payudaranya terlalu padat. Jadi bukannya problematika ras, tapi problematika diagnosa. So, there is another question, Doctor.
Yes.
Good evening, Dr. Kong. May I know what are the possible side effects of hormone therapy for breast cancer? Pertanyaannya, apakah ada side effect hormon terapi pada kanker payudara?
Okay. So the two commonest hormone therapy for breast cancer would be tamoxifen on one hand, and another group of drug is called aromatase inhibitors. And aromatase inhibitors include either drugs such as letrozole, anastrozole, azamastine. Let me talk about tamoxifen first. Tamoxifen side effects are not very common except for two things. One is there is a small risk of a woman taking tamoxifen of getting cancer of the womb, a uterine cancer. The risk is about 1% or so it's not very high, but women who take tamoxifen must go and see the gynecologist regularly, for example, yearly, to make sure that the lining of the womb doesn't gradually becoming more abnormal. Apart from womb cancer risk, another risk is that of a deep vein thrombosis, or DVT, which is a clotting of the vein in the legs, especially when they fly long distances to Europe or America. But that risk is not very common amongst Asians. The second group of drugs is called aromatase inhibitors, or AI. Now, AI side effects are different. There are three side effects of importance to you. Number one, the cholesterol will go up over time. Number two, osteoporosis may come in with time. And number three, people who take AI tend to get a bit of joint pain, especially in the morning. When they wake up, they find the fingers are very stiff. They need to exercise for about 5-10 minutes before they loosen up the fingers. But by and large, these two drugs are quite safe and the side effects are manageable.
Dr. Kong, your explanation is too long. Oke, saya coba teman-teman. Jadi ada dua jenis hormon. Yang satu tamoxifen, yang satu lagi aromatase. Ya. Yang tamoxifen itu side effect-nya pada sistem peranakan. Itulah sebabnya orang yang diobati tamoxifen harus berhubungan dengan gynaecologi karena ada kemungkinan gangguan pada sistem peranakannya. Sedangkan yang aromatase itu kolesterol, osteoporosis, lalu aching katanya, sakit-sakit atau pegal-pegal kalau dia bangun tidur.
Thank you.
Dr. Kong, your explanation is quite okay. I think teman-teman, ini Dr. Kong masih punya satu lagi topik yang sama menariknya. Dan topik ini akan menyangkut kaum pria. Mari kita ikutin topik berikutnya. Dr. Kong, your next session will be on lung cancer.
Okay. So I'm going to talk about lung cancer. Now, lung cancer obviously is a different problem, and it affects both men and women. And importantly, it affects people who are smokers, as well as people who don't smoke a single cigarette in their whole life.
Jadi, kanker paru-paru ini merupakan kanker nomor 1 kaum pria. Nah, kaum pria ini biasanya karena berbagai macam lifestyle atau kehidupan.
So I'm going to start the lung cancer session by talking about the symptoms of lung cancer. How would you suspect that you may have lung cancer? So the symptoms that are common will be persistent cough. Some people ask what is persistent cough because everybody coughs from time to time. Generally, we say that if a cough persists for 2 weeks or more, especially the cough that wakes you up from sleep, that's something you should worry about after 2 weeks. And of course, very worrisome if the cough produces blood in the sputum. And thirdly, if the patient has a shortness of breath. For example, last time you could climb 2 flights of stairs. Now after 1 flight you feel breathless. That's not good. If you have some chest pain when you cough or when you breathe, that's also some concern. And by the time the cancer is quite advanced, you may have loss of appetite and loss of weight, which can be quite significant. And finally, if the patient has headache that doesn't go away after 2 weeks, again, we're worried about cancer going to the brain. And last but not least, persistent bone pain. Again, the pain that doesn't go away after 2 weeks, especially if the pain is fixed in one location, not running around, but fixed in one location. And worst of all, if the pain disturbs your sleep, those are worrisome symptoms.
Apa saja gejala-gejala kanker paru-paru? Yang pertama kita harus pikirkan adalah kalau batuk terus-menerus. Jadi batuk terus-menerus ini pengertiannya batuk terus-menerus 2 minggu berturut-turut yang bahkan Anda harus terbangun pada waktu batuk. Yang lebih jauh kalau batuk itu mengeluarkan darah atau Anda mengalami nafas pendek terutama pada saat beraktivitas. Bahkan pada saat beristirahat Anda terengah-engah. Lebih lanjut, gejala yang lain adalah sakit di bagian dada. Kalau penyakitnya sudah lebih jauh, maka Anda akan kehilangan selera makan, lalu kemudian berat badan akan turun, lalu kemudian sakit kepala, dan yang barangkali ini menjadi ciri khas adalah nyeri pada tulang yang terus-menerus di satu tempat, dia tidak pergi kemana-mana, dan bahkan rasa nyeri ini sampai membangunkan Anda.
So, once the cancer is suspected, what are the tests that the doctors will do? Whether in Singapore or Indonesia, these tests are quite commonly done and quite universal. Now, first of all, the X-ray is usually the starting point. The doctor, either a GP or a specialist, will order the X-ray. And the next thing will be a CT scan. The CT scan looks at a lung in greater detail to position where the tumor is. And in many places, there will be an ordering of a PET CT scan. A PET CT scan is different from CT in the sense that it has activity that will show up on the scan. So the scan is in colors. So this is quite unique. And finally, it is quite common for the doctors to order an MRI of the brain because lung cancer likes to go to the brain. Besides these radiological scans, doctors will also do blood tests. And one of the important blood tests will be the measurement of cancer markers. There are many markers around. The most common marker is called CEA. And finally, very importantly, is a biopsy. Without biopsy, lung cancer cannot be treated. So the biopsy is obtained from the lung tumor or where it has spread to determine whether is it confirmed that lung cancer is there. Number 2, the type of lung cancer. But most importantly nowadays, we have to send the lung biopsy to what we call molecular tests. These tests will guide the doctors in choosing the right drug to treat the patient.
Kalau tadi kita tahu gejala-gejalanya, terus kalau dokternya menyangka ini sebuah kanker paru-paru, kira-kira akan melakukan pemeriksaan apa? Yang pertama, ada 3 jenis pemeriksaan: radiologi, pemeriksaan darah, dan pemeriksaan jaringan biopsi. Yang pemeriksaan radiologis mulai dengan ronsen dada. Di ronsen dada ini sebagai screening awal. Jika tersangka memang begitu, ada kanker paru, lalu dilanjutkan dengan CT scan. Seringkali juga harus dilanjutkan dengan PET CT. Nah, kalau yang PET CT ini dia ada warnanya sehingga akan nampak sebuah aktivitas dari kanker itu. Yang penting lainnya adalah pemeriksaan MRI otak karena kanker paru seringkali menyebar ke otak. Nah, pemeriksaan yang kedua adalah pemeriksaan darah. Apa yang diperiksa? Yang diperiksa adalah adakah marker atau penanda tumor yang disebut sebagai CEA. Yang nomor 3 adalah pemeriksaan jaringan atau biopsi. Jaringan itu diambil dari paru-paru, tanpa pemeriksaan jaringan ini maka dokter tidak bisa menentukan diagnosa dan pengobatan. Dan satu lagi dari jaringan paru yang diambil untuk memeriksa atau mencari informasi tentang molekul, profil molekul daripada kanker paru-paru tersebut.
The next slide, which we'll see later, shows you some of the common pictures that we acquire on the patient. You will see a chest X-ray showing a tumor. You will see a CT scan in the middle, and then you will see a PET scan that's in color.
Pemeriksaan yang berikut ini yang tadi disebutkan, pertama pemeriksaan ronsen paru, yang kedua pemeriksaan CT scan, lalu yang ketiga adalah pemeriksaan PET scan yang ada warna-warnanya.
The next slide that you will see would be how we use a cancer marker such as CEA, which is a very commonly elevated cancer marker in lung cancer patient. Typically, the CEA level will be very high at the beginning of the diagnosis, and with treatment, the number will drop. And by monitoring the CEA level over time, the doctor and the patient will get an idea whether the cancer treatment is working, whether the control is still good. The slide will show that quite clearly.
Slide berikutnya Anda bisa lihat grafik penanda tumor atau tumor marker. Pemeriksaan yang diperiksakan tadi sudah disebutkan CEA. Penanda tumor ini di awal-awal dia terdiagnosa pasti akan tinggi, tapi kemudian dia akan menurun dengan pengobatan. Sehingga seringkali pemeriksaan CEA bisa digunakan untuk memonitor kemajuan sebuah terapi.
This next slide that I'm going to share with you is a bit technical but important because a patient with lung cancer, these terms are commonly used by the oncologist. So having some idea of how oncologists classify lung cancer will help you to understand that the treatment differs. So broadly speaking, we divide lung cancer into small cell lung cancer or non-small cell lung cancer. So these are the two big groups. The common group is the non-small cell. And within that big group, the commonest type is called adenocarcinoma. That's the word that you will find in your report very often. So adenocarcinoma is the commonest type of lung cancer today. And they can happen in smoker or even in non-smoker completely.
Gambar berikutnya agak sedikit teknis karena ini memperlihatkan gambar-gambar mikroskopis. Jadi kanker paru-paru ini dibagi menjadi dua kelompok besar. Yang satu namanya small cell lung cancer, lalu yang berikutnya adalah non-small cell lung cancer. Nah, yang small cell lung cancer ini adalah yang paling umum terjadi dan biasanya ada nama lain, namanya adenokarsinoma. Inilah yang paling banyak jenisnya dari semua kanker paru-paru.
One of the important questions which my Indonesian patients ask me a lot is about the need for biopsy, because people have heard about how biopsy can lead to bleeding or leading to cancer spreading, but how important is biopsy? Now, the biopsy is very, very important. Without biopsy, we cannot know for sure what lung cancer type the patient has. And different type of lung cancer patients have different treatment. So the biopsy is crucial. And the biopsy comes in two types. The common type is what we call a tissue biopsy. You put a needle into the lung tumor or needle into the place where the lung cancer has spread, such as the liver. So the biopsy is a tissue biopsy. It's very useful because it tells us a lot about the cancer. We know what type and we can run molecular profile. The risk of bleeding and the risk of injury is there, but in experienced hands of the radiologist, biopsy is quite safe. The newer method is called the liquid biopsy or a blood biopsy. This biopsy is not as complete in providing all the information. It allows us to choose the drug appropriately, but sometimes the biopsy from the blood doesn't quite tell us exactly what cancer type it is. So we always prefer a tissue biopsy in the first place.
Kita masuk ke biopsi. Biopsi itu adalah cara untuk mengambil jaringan. Kenapa ini penting? Karena seringkali orang merasa efek sampingnya, misalnya perdarahan. Tapi tujuan dari biopsi itu sendiri adalah untuk mendapatkan diagnosa yang akan mengarahkan kepada pengobatan atau cara pengobatan. Ada dua jenis biopsi. Satu biopsi jaringan. Kalau biopsi jaringan itu bisa diambil dari paru-parunya atau bisa diambil dari jaringan yang lain di tempat lain. Dia menggunakan jarum kecil. Risiko untuk perdarahan di tangan seorang ahli radiologi, maka biopsi ini menjadi amat sangat kecil untuk mengalami perdarahan. Biopsi yang lain adalah biopsi cair, mengambil plasma. Biopsi ini tujuannya semata-mata untuk bisa mengarahkan cara pengobatannya akan dengan cara apa.
So I'm going to share with you how we treat the different stages of lung cancer. Just like breast cancer, we divide lung cancer into 4 stages, 1, 2, 3, 4. Stage 1 lung cancer is a small cancer. Stage 2 lung cancer slightly bigger. Stage 3 maybe with some lymph nodes. Stage 4 is when it's spread. So for stage 1, a small lung cancer, surgery is all that's required usually. Stage 2, slightly bigger tumor, you do surgery and then 3 months of chemo. Stage 3 is a bit more difficult to treat. We have to do chemotherapy plus radiotherapy. And stage 4 is when we use newer drugs like special tablets or immunotherapy and chemotherapy to treat the patients.
Ada 4 tahapan kanker paru-paru. Stadium pertama biasanya kecil, maka pilihannya adalah operasi. Kalau stadium 2 agak besar, operasi harus diikuti dengan kemoterapi. Kalau stadium 3 sudah ada ke tempat lain, maka pilihannya adalah kemoterapi dan radiasi. Dan kalau sudah ada pergi ke stadium 4, maka biasanya ada pengobatan menggunakan pil, cara-cara imunoterapi.
So the lung cancer treatment is very complex, and it is not possible within this short segment to explain the detail. I will now focus on 2 scenarios where lung cancers are commonly seen in Singapore, in Indonesia, so that you are familiar with them. And these 2 pertain to stage 4 lung cancer patients. So the first scenario is a woman who doesn't smoke cigarette. They have adenocarcinoma, and the carcinoma has a specific mutation called EGFR, very common mutation. So this is a very common pattern of lung cancer in Asia. In this group of patients, which happen to maybe about 60% of the non-smoking lung cancer patients, the treatment is tablets. You don't need chemotherapy, just tablets. And we now have first generation tablets, second generation tablets, and even the most advanced third generation or 3G tablets. And these tablets are effective. Patient can be on tablet for several years, and the side effects are usually quite mild, a bit of dry skin, a bit of diarrhea, usually very well managed. So you can imagine that 1 pill a day, like how you treat hypertension, can actually treat a stage 4 lung cancer for years.
Bagaimana sekarang kita ngobatinya untuk stadium yang lanjut? Dr. Kong mau kasih 2 contoh skenario. Skenario pertama adalah perempuan yang tidak merokok dan dia mempunyai adenokarsinoma dengan mutasi EGFR. EGFR ini sering terjadi pada kira-kira 60% dari semua karsinoma, adenokarsinoma paru-paru. Perawatannya biasanya dengan menggunakan obat tablet, bukan kemoterapi. Ada beberapa jenis tablet, ada generasi 1, 2, dan 3. Biasanya dia harus makan obat ini beberapa tahun. Kalaupun ada efek sampingnya ringan, seperti kulit kering, atau radang mulut, atau diare. Tapi itu bisa diatasi.
The second scenario will be a scenario where the patient is a heavy smoker and the cancer has no mutation. So these are the patients where we can't give tablets. No mutation, no tablets. So how do we treat them? In the old days, we treat them with chemotherapy. Nowadays, for the last 2 years, we either do chemotherapy together with immunotherapy, or we might even do immunotherapy without chemo altogether. So for such patients, immunotherapy has played a very big role in changing the future of cancer treatment in that subset of patients.
Contoh skenario yang berikutnya adalah pria tapi perokok berat dan dia tidak punya tanda-tanda mutasi. Nah, kalau dia tidak punya tanda-tanda mutasi, lalu pilihan terapinya apa? Pilihan terapinya adalah kemoterapi plus imunoterapi atau kedua-duanya. Kemoterapi dan imunoterapi ini adalah obat yang bisa diberikan secara masuk ke dalam infus. Biasanya 3 minggu, lalu kemudian berhenti gitu ya. Kemoterapi ini memiliki efek samping, tetapi efek samping dengan pengobatan yang sekarang itu bisa dikelola dengan baik. Jadi imunoterapi berbeda tentu saja dengan kemoterapi.
So since I talk about immunotherapy, I want to just elaborate that a little bit more because this is a very hot topic in oncology and many patients who come to see us do want to talk about it. Now, cancer immunotherapy for lung cancer is an important part of the overall treatment. It is a very interesting concept. The immunotherapy drugs, which is infused into the patient once every 2 weeks or 3 weeks, the drugs don't fight cancer directly. The drugs work on the patient's own immune system so that the immune system of the patient becomes stronger and that immune system itself will then fight the cancer. So this is a very interesting concept. And the side effects are very different from chemo. There's no hair loss, there's no nausea, vomiting, or drop in blood count. Unfortunately, immunotherapy sometimes make the immune system too strong. The immune system that's too strong can actually harm the own patient's body. So the patient's immune system can attack the own lung, attack the own heart, own liver, causing a range of problems, which happen to about 10% of patients who take immunotherapy. So it's a very interesting treatment, sometimes very effective, but can have some side effects. And interestingly, unlike chemotherapy, where once you stop the chemo, the cancer grow again, but for immunotherapy, once you're treated long enough, about 2 years, the cancer actually can be put into a dormant state for quite a long time.
Tadi kita sebut-sebut soal imunoterapi. Imunoterapi berbeda dengan kemoterapi. Karena kalau imunoterapi, kita memberikan obat yang mengubah perilaku kekebalan. Jadi kalau kemoterapi itu membunuh si kankernya, kalau imunoterapi itu membuat kekebalan kita menjadi tumbuh lebih kuat, lalu kekebalan tubuh itu sendirilah yang akan menyebabkan si kanker itu mati. Sistem kekebalan ini cukup efektif, tetapi juga ada efek sampingnya. Efek sampingnya, kalau kekebalan tubuh orang itu menjadi jauh lebih kuat, lalu kekuatan kekebalan ini akan mengganggu tubuhnya sendiri. Dia bukan hanya mengganggu si sel kankernya, tetapi organ-organ tubuh yang lainnya bisa diganggu. Sehingga kita perlu memonitornya. Imunoterapi kadang-kadang dapat menyebabkan efek samping seperti yang tadi, tetapi biasanya kalau dimonitor lebih baik itu akan bagus. Satu lagi tentang imunoterapi, kalau kemoterapi dihentikan, si sel kankernya tumbuh lagi. Tapi kalau imunoterapi biasanya selama 2 tahun, si sel kankernya akan tidur. Dan dia bisa tidur beberapa tahun sehingga tidak muncul-muncul lagi.
So in my last slide on this segment of lung cancer, I just wanted to share the importance of controlling smoking. It is true that not all lung cancer patients are smokers, but there is very clear scientific evidence that people who smoke cigarettes are more likely to get lung cancer. And the more cigarette you smoke a day, the higher is your risk of lung cancer. And not only lung cancer, smoking leads to other conditions such as cancer of the bladder, cancer of the pancreas. It can also lead to other problems like heart attack, stroke, emphysema. So stopping smoking is good for you. It is also good for people around you. So our advice as doctors to everyone out there is do your very best to stop smoking. It saves lives.
Bagaimana kita cara mencegah kanker paru-paru? Dr. Kong memberikan pesan bahwa rokok itu sebaiknya dihentikan atau dikurangkan. Memang ada penderita-penderita yang tidak pernah merokok, tetapi fakta statistik membuktikan bahwa orang yang merokok bisa meningkatkan risiko kanker paru-paru. Bukan cuma kanker paru-paru, bisa juga mengganggu bisa menyebabkan penyakit-penyakit yang lain seperti emfisema, penyakit jantung, stroke, kanker yang lain. Jadi pesan Dr. Kong, usahakanlah semampu Anda mungkin bisa lakukan berhenti merokok. Karena bukan hanya baik untuk Anda, tapi juga baik untuk lingkungan. Berhenti merokok itu akan menyelamatkan nyawa Anda dan menghemat uang Anda. Dr. Kong, let us allow our audience to question. Yes?
Yes.
Sudah ada pertanyaan? Mari kita lihat sebentar pertanyaannya. Oke. Dr. Kong, saya perokok usia 30 tahun. Saya sudah merokok sejak 18 tahun. Seberapa khawatir saya tentang kanker paru-paru? Haruskah saya menjalani screening tahunan? I'll try to explain. I am 30 years old, been smoking 18 years. Do I have to worry with my cancer? Should I screen yearly?
Well, I would say to this particular viewer, you are young, you are 30-year-old, although you have smoked for 18 years, it's never too late to stop. Once you stop, the risk of cancer doesn't go away immediately. It still stays with you for more than 10 years. But with time, and you're only 30-year-old, with time, your risk of cancer will come down. I would say that because 30-year-old is not a common age to get cancer, the likelihood of you getting cancer now is not high, but you should monitor for symptoms. And certainly when you have symptoms such as cough that doesn't go away, see your doctor early. And for patients who smoke longer and they are older, let's say they are 40 and above, maybe it's not a bad idea to consider a regular screening. In some places in the world, they will consider a low-dose CT scan to screen those people who have smoked for even longer period than you have.
Dr. Kong bilang, semakin cepat Anda berhenti merokok, semakin baik. Jadi usahakanlah berhenti. Dengan usia 30 tahun Anda punya chance untuk tidak terkena kanker, walaupun efeknya baru akan 10 tahun. Tapi berhentilah sekarang. Kalaupun Anda punya concern untuk melakukan screening tahunan, Dr. Kong bilang, low dose CT scan.
Yep.
Low dose CT scan. Anda punya kesempatan untuk bisa melakukan screening tahunan. Dr. Kong, there will be another question.
Yes.
Hold on. I think this question coming from me.
Okay.
Teman-teman, ini seringkali di Indonesia bilang, kakek saya 96 tahun masih merokok. Jadi meninggalnya 96 tahun dan tidak kena kanker. Bagaimana ini bisa dijelaskan? Let me explain. My grandpa saying 96 years old, no cancer, he died without any lung cancer. How could we explain
He's a
this?
smoker.
He is a smoker. Yes.
So we know of people around us, even famous people like Deng Xiaoping, the former leader of China. They smoke all their lives and yet they don't get cancer. That's true. There are always exceptions like that. Maybe it's that constituent, their own body constitution is different, their genetic makeup is different, but not many people are as lucky as those individuals. So I would say that if you were to smoke and you hope that you will get away without any serious consequences, it is a big gamble because most patients who smoke a lot they are not so lucky. They do come down with serious conditions. So you mustn't look at the few exceptional people and use that as your guidance.
So Dr. Kong pesannya memang itu mungkin terjadi, tetapi Anda jangan berjudi dengan hidup Anda. Karena fakta-faktanya mengatakan bahwa orang-orang perokok memang mempunyai resiko untuk kanker lebih banyak. So Dr. Kong bilang, cobalah melihat bukan hanya observasi satu orang, tapi lihatlah populasi. Karena kalau cuma observasi satu orang, ada kekecualian, tapi kalau melihat observasi banyak orang, maka Anda akan mendapatkan kepastian. Pesannya jangan gambling. Dr. Kong, this is a very comprehensive explanation. Saudara-saudara sekalian di tanah air, kita sudah di penghujung acara, tapi saya ingin meminta sama Dr. Kong buat Anda semua barangkali ada short tips untuk kanker payudara dan kanker paru-paru. May I have your short tips at the end of this presentation, Dr. Kong?
So for breast cancer, it is important to detect it early because early detection of breast cancer leads to cure in the majority of patients. So therefore, going for mammogram screening is important for you. For lung cancer, screening is not so easily done, but the key is even with advanced lung cancer, there are many good drugs out there, and people with lung cancer, even though stage 4, should not give up treatment. And before you get lung cancer, if you're a smoker, do heed the advice, stop smoking is good for you, good for your loved ones.
Dr. Kong bilang untuk breast cancer yang paling penting adalah mamografi. Untuk lung cancer agak susah untuk diagnostik, tetapi pengobatan bahkan stadium 4 pun sekarang sudah jauh lebih baik. So Anda jangan putus asa, lakukan pengobatan itu. Dr. Kong, thank you very much for the explanation. Teman-teman sekalian, kita sudahi acara ini. Jika Anda yang terlambat untuk mengikutinya, Anda masih bisa melihat kembali di sirkulasi yang sudah disampaikan, dan Anda masih bisa bertanya juga. Pertanyaan-pertanyaan Anda akan dijawab oleh Dr. Kong, dan bahkan pertanyaan-pertanyaan buat mereka yang melihatnya mungkin sudah 1 bulan atau 2 bulan yang lalu, Dr. Kong akan menjawabnya. Isn't it?
Yes.
So you are answering, you are going to answer all the inquiries from the audience. Sampai di sini teman-teman sekalian, kami dari Icon dan kami dari Smarter Health mengucapkan selamat malam, selamat beristirahat. Bye-bye.
And I wish the viewers a good year, good health, and long life. Bye-bye.